Hi, good morning. My name is Sochi, and I'm here to talk to you all about prostate disorders and erectile dysfunction. Let's get started with what and where is the male prostate gland. Of course, the prostate is a gland in men only, and it surrounds the neck of the bladder. It's the deepest part of the urethra and produces a fluid that becomes part of the semen. It is about the size of a chestnut located in your pelvic cavity. If you see the picture, it'll give you a picture of the male reproductive system. You have your bladder. You have the prostate right underneath it, which hugs the urethra and exiting the urine through the urethra and out through the penis. The prostate gland can be felt because of its location in the pelvic cavity, especially if it is enlarged or inflamed. It is composed of glandular and muscular tissue, and it does contract during ejaculation of seminal fluid. We're going to look at prostate disorders that affects this age group of 55 through 65 years old. We have our first one called prostatitis. It is the inflammation, usually caused by bacterial. 80% of it is bacterial. There may be other causes, and we'll talk about it right now. We also have enlarged prostate or benign prostatic hyperplasia, which is abbreviated by BPH. And this is another common problem in older men, which may cause There are signs and symptoms that can tell you that your prostate is inflamed or you have an infection. Usually it's a lot of infection signs and symptoms such as chills, fever. You can get lower back pain, perineal fullness, so you have that sensation of going to the restroom even though you just went. Maybe you're unable to empty the bladder completely. You do urinate at night, called nocturia. You do get transient erectile dysfunction. Your urine can be cloudy, and there may even be there may even be blood in the urine. There are treatments of prostatitis. Of course, you're going to get your systemic antibiotic treatments, your aminoglycosides, usually a combination with penicillin or cephalosporins. You can get the transurethral resection of the prostate, which can remove the infected tissue. And of course, there is supportive therapy, bed rest. You want to make sure you hydrate. Make sure you take pain medications. You also want to take anything if you have a fever, lower the fever. And a stool softener. Of course, this will help if you have pain and you're afraid to go to patient and family teaching. You want to let the patient and family know the importance of the medication to finish the prescribed antibiotics and the possible side effects that it may give them. You want to let them know the importance of drinking at least 8 ounces of fluids per day, and the importance to stay sexually active or ejaculate regularly to promote drainage of the prostate secretions. Advise patients to use condoms during sex, however, if they have a flare-up of prostatitis. We're going to talk about enlarged prostate or benign prostatic hyperplasia, BPH. It is very similar to prostatitis. It does enlarge again. However, it is not caused by bacteria. This is due to tissue changes in the periurethra. A theory of BPH is changes in hormonal activity. Other theories have contributed to arteriosclerosis, neoplasm, metabolic or nutritional disturbances. And once again on the diagram, you can see the difference between a normal prostate and the enlarged prostate and how it compresses the urethra. Signs and symptoms. Again, you have the decreased urine stream or flow, difficult starting to urinate, dribbling, retention, incontinence, possible blood in the urine, and incomplete voiding. Treatment for BPH. You want to go ahead and massage the area. Cyst baths have also been known to help. And you may be possible short-term fluid restriction. Of course, this is only short-term once again, and your physician should tell you. You have alpha adrenergic blockers that relax the prostate and bladder muscles. You can also have surgery or transurethral microwaves, and these are heat waves that can help for BPH. Patient and family teaching. You want to tell the patient and family signs and symptoms of a UTI. You want to report these immediately to your physician. If you're taking the medication, once again, the importance of taking the full dose of the antibiotics. If you can't void or there's blood, you want to go ahead and contact your physician. If surgery is done, you want to teach the importance of the limitations of activity after the surgery. And you want to reassure patient and family that after the surgery and the removal of the catheter, urinary control will return gradually. As you can see, the prevalence of BPH does increase with age. For ages 51 to 60, you're looking at 42%. From 61 to 70, it jumps all the way to 75% chance of getting BPH as you get older. Prostate cancer. It is the leading cause of male cancer death. It's adenocarcinoma. They originate in the posterior prostate gland, with the rest growing near the urethra. Risk factors for getting prostate cancer. Again, age, usually older than 50 years old, infections, and endocrine factors. Signs and symptoms, unfortunately, are not revealed until you have advanced symptoms. However, after the age of 40, prostate exam by your physician is recommended, and it can be done by a physical exam and also blood work, where it'll detect cancer. Now, the signs and symptoms are frequent urination, retention. You're going to have back or hip pain, blood again in the urine, pain when urinating. You might have swelling to the scrotum, which are your testes, and swelling to the legs. Treatment includes radiation, removal of the prostate, removal of testes, maybe hormone, and of course chemotherapy. Patient and family teaching. You want to encourage the patient and family to maintain a lifestyle that is nearly normal during recovery. Before surgery, you want to go ahead and explain some expected results such as impotence, urinary incontinence, or erectile dysfunction. You want to teach the patient perineal exercises before surgery, how to do it sitting and standing to strengthen the perineal muscles. You want to change and teach the patients and family how to change the dressings that will be needed. Signs and symptoms of infection. And inform patients of pelvic radiation of the side effects as well, such as diarrhea, bladder spasms, rectal irritation, and frequent urination. Erectile dysfunction, or ED, refers to the inability to attain or maintain penile erection long enough to complete intercourse. There are different stages: primary ED, secondary ED, partial, intermittent, and selective. Now, ED can affect all men of any age, but it does increase as you get older, the percentage. It can have an organic cause. Usually for chronic diseases, you're looking at 40% vascular, 30% diabetic. Sometimes it can be due to medication. Other things are neurological causes or endocrine problems. We do have spinal cord trauma, central nervous system defects, hormones, smoking. Those are all organic chronic diseases. You do have psychogenic causes, which are interpersonal. This is internal guilt, fear, depression, feeling of inadequacy, maybe religion takes its place. You also have interpersonal, which is sexual preference, maybe insufficient knowledge or lack of communication. Those are all interpersonal conflicts. Treatment for erectile dysfunction, if it's an organic cause, surgery can be implemented, and this is inserting an inflatable or semi-rigid penile prosthesis. Medication can also be given. Of course, you need to talk to your physician with this, especially if taking other medication for blood pressure, because it could cause a significant drop in your blood pressure. Cialis and Viagra are some of the medications. If it's psychogenic, therapy is usually the way to go. You can see a sex therapist, focus therapy, increased verbal communication, decreased guilt, maybe reevaluating the attitude. Decreasing anxiety and stress can also help. Patient and family teaching. You want to provide instructions concerning anatomy and physiology of the reproductive system and the response cycle. You want to provide helpful guidelines and information on therapists. If surgery was done, you want to instruct the patients the importance of putting ice packs to the penis for 24 hours. You want to show them how to empty the drainage device, instruct them how to pull the scrotal pump downward and ensure proper alignment. You want to make sure you focus and telling them how to avoid intercourse until the incision heals, usually up to 6 weeks. You want to show them signs and symptoms of infection so they can report to their physician. And you want to show patient how to practice inflating and deflating the device. I hope this has helped, and thank you for listening.